It's Medical Monday, and today we're going to be talking about male factor infertility with East Cooper Medical Center. Now, East Cooper is the ABC News 4 hospital expert, and joining me today is Dr. Stephanie Singleton. Good morning to you.
Good morning. Thanks for having me.
Now, let's talk about this particular issue because I think sometimes when couples are planning to expand their families and there are some problems conceiving, we kind of always think that when infertility is an issue, it's with the woman side, but infertility among men, common.
Very common, and you're right. Traditionally, because we were the ones having the baby, people assumed that it was a female problem if conception didn't occur. We now know that probably 30–45% of the time it's actually a male contribution that is causing the difficulty.
Now, male factor, what is that exactly?
Right. So male factor infertility is when you have some issue with either production of the sperm or acquisition of the sperm. It may be that the sperm count is low, it may be that the motility is low, or that the shapes of the sperm are abnormal. So any of those things can actually contribute. Some men don't produce sperm at all. So certainly something that needs to be looked at more closely and can absolutely contribute to difficulties with conception.
Now, what causes something like that? Is it true? I'm hearing that heat causes that. Heat is a factor. What type of, what are we talking about when we're talking about heat?
It can absolutely affect the production because we know that any increase in the temperature that the testicles are exposed to can cause a decrease in the production of sperm. And because there is constant production, this can be overcome. So if they have constant exposure, sitting in a hot tub consistently, we see it with a lot of men that are cyclists that have that increase in the heat all of the time. An increase in the male weight can cause an increase in heat. Any of those things can subsequently affect the sperm production.
Now, here's a question, especially when couples are trying to conceive. When would be a time for a male to consider perhaps getting tested for male factor infertility?
Absolutely early on. So when we look at the basics, when a patient or when a couple presents with infertility, that's one of the first tests that we recommend. So we're recommending that we look at egg production, that we look to make sure that the uterus is capable of carrying a pregnancy, that the fallopian tubes are open, and absolutely looking at a sperm count and a semen analysis early on.
Now, I would imagine, just as a little sidebar, I would imagine that most men, sometimes they're like, whoa, I possibly cannot be the problem. What does that do to them kind of mentally? How are they presenting themselves to you when they're diagnosed with that?
Oftentimes they're very hesitant, and it takes some reassurance because they do feel like it affects their manliness if the testing does not come back normal, and that's not the case at all. We know that this is a medical issue, and so it does take some explanation, some counseling. Certainly when they have this testing, we sit down, we talk about the results, we talk about how this can affect them. It may be a side effect of another medical disorder that they have.
And so that is possible.
Absolutely possible. So there are certain times, depending upon the results, that we recommend subsequent blood tests, that we'll recommend that they see a urologist. And we work closely with several of the urologists in the area who had additional training in issues of infertility, and so we can follow up on those things.
Absolutely, but the important thing to know is that it is treatable.
Absolutely, it is treatable, and that is the most fortunate thing. With the advent of in vitro fertilization and intracytoplasmic sperm injection, we call it ICSI, it makes it much easier to overcome male factor infertility, actually. So even though we sometimes can't fix it, we can overcome it, and couples can still have genetic children with even low sperm counts, with very, very high pregnancy rates in the range of 50 to 65%.
All right, and those are some good percentages right there. Doctor, thank you so much for joining us.
Absolutely,
Thank
you so much.
My pleasure, my pleasure. All right, you can visit abcnews4.com/experts for more information on this topic.